The doctor is in.
Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at bladder infection symptoms and treatment. Now before we describe the symptoms and treatment of a bladder infection, first we should define what is a bladder infection. Well, it's actually a very simple concept. If you look at analogous structures of your body, you can get sinus infection, eye infection like conjunctivitis, throat infection like strep throat, lung infections like pneumonia. The bladder is no different. The bladder is basically the body's urinary container. It holds the urine, stores it until we're ready to evacuate. Otherwise, life would be pretty inconvenient for us, constantly dribbling urine all day. So the other thing to understand is that different bacteria have different proclivities, different environments that they find favorable. So again, using an analogy, you'll find polar bears in the North Pole, not in Africa, where you'll find lions, but you're not going to find lions up in the North Pole. So with bladder infections, the dominant species that tends to have an affiliation for the bladder would be a bacteria called Escherichia coli, or shorter, E. coli. And the reason we shorten it is, as you saw there, it's a tongue twister. Another one would be Proteus, but by far the most common one I see in practice is E. coli. Now, the reason for that, there's a rationale to that as well. The reason for that is your alimentary tract, your digestive tract, is laden with these E. coli bacteria. And there's not that much distance between the anus and the urinary tract. So it doesn't take a great leap of understanding to see why you would tend to find E. coli colonizing the bladder, as they basically are neighbors. They live right next door all the time. The next thing you might wonder is, well, urine seems to have practically nothing in it. What do the bacteria get out of it? Well, to the naked eye, it might appear like urine is basically sterile and there's nothing to feed on, but bacteria actually has small amounts of proteins in it and sugars, and as proof of concept, if you walk past a public urinal, like some of those side streets that are infrequently frequented, that people use as a public restroom, that foul stench in the air is caused by bacteria living off of the urine that people have deposited there. So there actually is food for these little microbes in urine. Now, the next thing before we go on to symptoms and treatment is there's a big asymmetry between males and females for bladder infections. In my practice, I would say 99 out of 100 cases that I see in the run of a year are females, not males. Now, again, going back to that E. coli story, if I explain it to you, it will seem fairly obvious why that would be the case. If the E. coli are coming from the anal area towards the back and tracking themselves towards the front to get into the urinary tract, obviously in females with the opening, the vaginal opening being so close to the external surface, as opposed to male where the bacteria would have to track up the scrotum, along the penis. It's a long journey to try to get into the bladder for a male, whereas for a female, it's like a shortcut. So that is why females are so much more frequently affected than males. In fact, when I see a male with bladder infection in my clinic, I'm usually surprised. All right, so let's move on to the symptoms. Whoops, not that one yet. Oh, actually, this slide here illustrates it beautifully. I forgot I had this slide on here. This is in a female. This female here is obviously having some suprapubic distress. Suprapubic just means above the front pubic bone, which is where the bladder lives. So she's probably feeling some burning or cramping in that area there. In this little diagram here, you can actually see where the bladder sits. So the kidneys do their filtration business. It runs down these tracts here and then ends up in the storage bag, which we call the bladder. This is just a blow-up of the same image. Now, if you look at the urine in somebody that has a fulminant bladder infection, you see it doesn't look clear and nice like typical urine. It's very dark and cloudy. That's a consequence of the bacterial load inside the urine. And this dipstick chemical indicator, we actually use in our clinic to determine, before setting off the urine for an actual culture where you actually try to plate it out and see what grows, you can get a pretty good indirect indication that somebody has a bladder infection from one of these chemical indicators. So this purple mark here, that is an indicator of SNOT cells or white blood cell load. So again, it's an infection like any other in the body. If you get a nose infection, sinus infection, you'll see snot coming out. If you get pneumonia, you'll cough out snot. In the same way, the bladder leaches the snot out in the urine. The other thing that we look for is this pink one here, which is another byproduct of bacterial metabolism called nitrate. And the other thing we look for, I'm not sure on this stick which one, oh, probably this one here, this green one. At least on my sticks at clinic, this green one here would be an indication of blood. So again, in the same way when you have a sinus infection, you can get bloody discharge when you blow your nose. A lot of the time, the irritation caused by the bacteria inside the bladder and along the urethra will cause blood to be present in the urine. So those three things are the typical things that we look at as a ready reckoner of whether somebody's suffering with a bladder infection when they come into our office. We just ask for a pee sample, you dip it, within 60 seconds you'll see these squares light up. Now, what are the symptoms that bring someone to seek treatment? Well, the symptoms should all logically flow. The infection is basically considered by the body or perceived by the body as a toxin or something noxious. So just like if you had a stomach bug, how you would try to vomit to expel it from your system, the bladder does the same thing. So you get urinary frequency, which means that you pee much more often than you normally would, and that's because of the irritation occurring to the muscle lining. So that's one of the main things that you notice is the urinary frequency. The other is urgency. And the urgency, again, is because the bladder, each time it starts to fill, it wants to empty itself. So you find it hard making it to the bathroom because as soon as you get the desire to urinate, it feels overwhelming. When nature calls, you feel like you just have to go on the spot at that moment. You can't hold it. And probably the most common symptom or the most offensive symptom that will make someone present for cure is the urine burns. So unlike in pneumonia and sinus infection and stuff, that is almost kind of specific to urinary tract infections. Typically, if I get a sinus infection or you get a pneumonia, you don't get any burning sensation. You may get pain, but for bladder infections, the pain is a kind of burning, especially as the urine is passing by. All the tissues are raw along the conduit, so as you pee, it burns them as they're passing through. Typically you don't get fever with bladder infections unless the bladder infection has traversed up these conduits here to the kidneys. Most cases when I see someone with a bladder infection, all of the tells are in the urine and the story, not so much by checking someone for fever. Now for treatment, there are some home remedies. The only one I could recommend, because we have evidence in clinical studies, is drinking a glass of cranberry juice. This is actually more useful for prevention of a bladder infection rather than active treatment when you have a bladder infection. Most cases when I see them come into clinic that have tried cranberry juice or cranberry pill extract, typically hasn't worked for them. So that's not to say there may be an unseen population of people where the cranberry juice did work for an active infection. It's just that if it worked for them, they would never have come into clinic in the first place, so I would never have seen them. But in general, when I see people coming into the clinic with a bladder infection and they've already tried the cranberry juice or cranberry extract, it was useless to them, it didn't help. So for that reason, I would say it's probably more useful for prevention. Like some females are unlucky enough to get a bladder infection practically every single month. So in cases like that, it would make sense for them to take a glass of cranberry juice every morning or cranberry pill extract as a preventative. But to me, once you have a full-blown established bladder infection, you're far better off escalating to our nuclear therapy of antibiotics. And there are many different antibiotics that we tend to use as urinary antiseptics. So some common ones we use all the time would be nitrofurantoin or macrobid, ciprofloxacin, Septra, which is a sulfa drug. I would say those are the three most common antibiotics that I personally prescribe for bladder infections. And results are usually spectacular. Within 24 hours, most of the symptoms have subsided. And usually within 2 days, the individual feels pretty much tickety-boo back to normal. So that in summary is bladder infections, what causes them, the symptoms, why they're so much more common in females, and how they're treated. So that's it. Thank you for watching. And don't forget to subscribe so I can keep you updated as I upload new videos. So stay well and have a great rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.